Hi, this is Dr. Brenda Morthy, and this video is going to explain how you should prepare for your breast surgery. If you're having a lumpectomy and lymph node surgery, this is the video that you should be watching. So just remember, at the Comprehensive Breast Center of Arizona, we pride ourselves on taking this journey with you. So let's dive right in and go over what tests you'll need, what medications you should stop, when you should stop eating or drinking, and any other important tips. So during the time of the pandemic, all patients need to be COVID negative before they come into the hospital. So I've tried to list the facility and who will give you those instructions. So if you're going to Honor Health, Piper, or Shea, or Boswell, the facility will call you directly to coordinate with you when and where you should go for testing. If you're going to Honor Health Deer Valley, my scheduler will give you instructions. A lot of patients ask me about visitors. Please clarify with the hospital who can come in and wait for you or who must wait in their car. So again, 5 days prior to surgery and 2 days after your surgery, don't take any aspirin, prescribed blood thinners, fish oils, garlic supplements, vitamin E, herbal remedies, or any other supplements. This is a reminder slide of not taking any anti-inflammatories like Advil, Motrin, ibuprofen. Tylenol will be fine to take. If you're diabetic, you should take your diabetic medications the night before surgery. Take half your insulin dose the night before surgery if you take insulin. But on the morning, don't take any insulin or any diabetic medications. Now, if you're on blood thinners, I've given the time frames of when you should stop. So if you're on Coumadin, stop 7 days prior, Eliquis 2 days prior, Plavix 5 days prior. If your blood thinner is not on this list, please let me know. So the night before surgery, don't eat or drink anything after midnight. We will go over what medications you normally take in the morning and what is okay to take with a small sip of water. When you're packing for the hospital, please leave all your valuables at home and remove all piercings. And this includes earrings, tongue rings, any wedding rings or any rings at all, because all of these things can interfere with the surgical instrumentation. Don't wear any makeup, no nail polish, no contacts, glasses are fine. You must have someone to drive you home, otherwise the hospital will cancel your surgery. So let's go through and talk about what a lumpectomy is and what lymph node surgery or sentinel node biopsies are. So if the area that needs to be removed in your breast can be felt, then we just go to the operating room and I remove that area. However, if the area that needs to be removed in your breast cannot be felt, then I need help to know exactly where the area to be removed is located. And that can be done with two different modalities. One is what most commonly I'll use is a radioactive seed that's placed into the breast or a wire. So you won't have both, it'll be one or the other. The purpose of the wire or the seed is to show me the area that needs to be removed and to guide me to that area. So patients who have biopsy clips, these biopsy clips cannot be felt by surgeons. They can't be seen. They are like about 1 or 2 millimeters. So therefore, these cannot guide surgeons to the abnormal area. So if you're going to have a wire or radioactive seed placed, I put the facility down and where that placement will occur. So if you're having your surgery at Honor Health Deer Valley or Surgery Center, your wire or seed will be placed at the Breast Health and Research Center. If you're going to Piper or Shea, you'll have your wire or seed placed at Smile. And if you're going to Banner Boswell, your wire seed will be placed at Lakes Medical Imaging. So the procedure to place the wire or the seed is done prior to the surgery. It's done with local anesthetic. The whole setup is done very similar to how the needle biopsy was performed, except that they're not pulling anything out, but simply just placing something into the breast. Wires can only be placed on the day of surgery. The advantage of the radioactive seed is that it can be placed a day or two before surgery, and therefore surgery can actually happen earlier in the day. So the radioactive seed is what I generally will prefer and what we do at most hospitals. Again, the purpose of the radioactive seed is when we cannot feel the area that needs to be removed. The clip that's placed at the time of the needle biopsy cannot be felt. Therefore, the seed is placed next to the clip to help guide me as the surgeon to the correct area. The seed and the clip are all removed during the surgery, along with the area that needs to be removed. And again, the advantage of the seed is that it can be placed several days prior to surgery. If you need a wire, then the wire will be placed into the breast right next to the clip. And again, the wires are used when we cannot feel the area that needs to be removed. The clips that are placed at the time of the biopsy cannot be felt. The purpose is to guide me as the surgeon to know the area to be removed. So the wire, the clip, and the abnormality in the breast are all removed during the surgery. And again, wires can only be placed on the day of surgery. So let's just talk about sentinel node biopsies. So if you have a diagnosis of cancer, we would have talked about doing a sentinel node biopsy in most cases. So a sentinel node is basically the lymph nodes in the armpit on the side of the cancer where the cancer would drain to. So we know there's a lot of lymph nodes in our armpits, but there's only a couple that are the gatekeeper lymph nodes. And it's these gatekeeper lymph nodes that we remove in order to test to understand if the cancer has gone there or not. So a lot of times people will mistakenly think if I'm taking out lymph nodes that there must be cancer in them. That is not at all correct. The only way that someone can establish if there's cancer in the lymph nodes is to actually take out the lymph nodes, look at it under the microscope, and see if there's cancer cells there. But we don't want to take out all the lymph nodes. We want to just take out the gatekeeper lymph nodes. But how do we really identify those gatekeeper lymph nodes? Well, there's a procedure that we do, which is called the sentinel node biopsy. And in order to prepare for that, there has to be an injection of a radioactive solution that's injected around the areola. And so that solution is taken up by the lymphatic system, and then it transfers it to those gatekeeper lymph nodes. While you're asleep in the operating room, I also inject some blue dye, which does the same thing. So both of these will increase the chance that I find that sentinel node and makes it easier for me to find. So again, this is sort of a pictorial description, is that with the sentinel node biopsy, what happens is that we inject some dye around the areola, and that is radioactive. And then I do the same thing with blue dye while you're asleep. Both of those dyes will go to the lymph nodes that are located in the armpit, and then an incision is made, and I use a special probe to find that radioactive material that's been taken up by the lymph node. So then those lymph nodes are then removed along with the lumpectomy, and then that will go to pathology. Now, if you're having your surgery at Piper Surgery Center, then the radioactive injection is done at Smile or at Piper. So I will give you some numbing cream to apply around the areola. So here in yellow is where you would apply it 2 hours prior to coming into the facility. And I will send that cream over to your pharmacy. When you're asleep, I also inject the blue dye. Remember, the blue dye can cause your urine and stools to be blue-green after surgery, so don't let that alarm you. If you're having your sentinel node done, or if you're having your surgery done at Boswell or Deer Valley, both injections are done while you're asleep, so you don't need any cream. And again, those injections are done around the areola, and that will travel to the lymph nodes. I use a special probe after making an incision in the armpit to take out the lymph nodes that have turned blue and have taken up that radioactive material. So if you're having the lymph nodes removed or the sentinel node biopsy and a lumpectomy, you'll have 2 incisions on the breast. After surgery, you'll go to the recovery room, and you'll stay there for about 45 minutes to an hour. You'll go there until you're ready to go home. A lumpectomy with taking out lymph nodes is a day surgery. You go home the same day as surgery. If for any reason I have to take out more lymph nodes, that is also a day surgery. Please bring with you appropriate clothing and a responsible adult who can take you home. I will give you a prescription for pain medications as well. All right. So you will already have a follow-up appointment. My scheduler would have given this to you. It would be about 2 weeks after surgery. We will have your pathology report by that time to discuss with you. If we get it earlier, then myself or my physician's assistant will call you. You would have had referrals already to a medical oncologist and a radiation oncologist, and you should make those appointments to be timed about 2 weeks after your surgery, so that allows pathology reports to be available. Medical oncologist is someone who prescribes medications like a hormone blocker or chemotherapy. Radiation oncologist is someone who administers radiation. I will let you know who I've made referrals to at your initial appointment. So, for incisions, what is a lumpectomy incision? That's on the breast. It's about 2 inches. When we take out lymph nodes from the armpit, that incision is also about 2 inches, and in the armpit, all are closed with dissolvable sutures. When you wake up, you will have one of two things, either a breast binder and an ACE wrap on top of it, or just a breast binder. Either way, keep that on for the first 24 hours. After that, you can take it off, shower, transition to a sports bra. What you will see is some gauze, and then the incisions will have glue on it. That glue will flake off over time. There's no reason to pick it off or pull it off, just leave it alone. If your surgery is a coordinated surgery with a plastic surgeon, please clarify their dressings and post-op instructions. You can shower 24 hours after surgery. Please remove all the dressings and shower. Avoid soaking the incision, so don't take a bath or go swimming. Swelling is normal. If there's a lot of swelling or if there's a lot of bruising, make sure you call our office. Infection is not common, but things to watch out for include redness, drainage, or a fever of 101.5 for over 24 hours. We always have a doctor on call, even on weekends and after hours. Most people will only need extra strength Tylenol for after surgery. I will give you a prescription also for some Tramadol in case you need something stronger. If you are taking the narcotic pain medications and you cannot drive, you should take it with food and also take it with a stool softener. Make sure you drink lots of water and walk a lot, since both of these will stimulate the gut. For 2 weeks after surgery, we recommend no heavy lifting over 10 pounds, no swimming or soaking in a tub. Driving, you can resume if you're not taking any narcotic pain medications and have a full range of motion with your arms. The first 24 hours after surgery, your diet should be bland. It is normal to have nausea for up to 48 hours. If it lasts longer, then please call our office. Make sure you drink plenty of fluids to lower the nausea. You can resume most of your medications. If you are on a blood thinner, I will let you know when to start that blood thinner. As far as what bra you should wear a supportive bra with no underwire, and I recommend wearing it all the time, even to bed, for a week or two, or at least until you're seen in the office. These are the reasons I've listed to call our office. If you have a fever over 101.5, if you have nausea or vomiting over 48 hours, you have drainage or spreading redness of the incision. However, if you experience shortness of breath or chest pain, please go to the emergency room. And again, we do have a physician on call after hours at all times. Please use our direct office number to reach the doctor on call, which is 602-374-3440. Some of our surgery schedulers do use a texting service. Please do not text or use any direct numbers after hours or on the weekends. If you have FMLA paperwork, I've included my scheduler's fax number and her email address. And again, we are privileged to take this journey with you.